Good morning. I'm Dr. Sean Coomer, Chief Medical Officer for the Kansas City Division of the University of Kansas Health System. Welcome back to Open Mics. Living with sickle cell disease can feel like torture. There's frequent pain, a lot of time spent in the hospital, and unfortunately, a shorter lifespan. But today, we're exploring new gene therapies that promise to cure sickle cell disease with far fewer side effects than a bone marrow transplant. With me today is Dr. Leila Shunay, a hematologist and oncologist. These new gene therapies have a lot to offer some of our patients. Also here is nurse Sarah Steele, a BMT coordinator. She helps guide patients and their families through the blood and marrow transplant process. Last but not least, Linda Oga is here, who's living with sickle cell disease. Linda, we're happy to hear your perspective as a patient because this is one of the diseases where people often don't understand the toll it takes. Dr. Shunay, let's start with you. The words sickle cell refer to the literal shape of the deformed blood cells. Can you help explain what problems these pointy blood cells can cause?
Absolutely. So we all have red blood cells. They're part of how we carry oxygen throughout our body. The normal red blood cell is a disc-shaped, very pliable, soft cell that moves easily around the body. Unfortunately, our patients inherit a genetic condition whereby this protein within the red cells can be deformed and be very stiff and be shaped like a crescent, hence the name sickle cell. And when they are deformed, they stick together and they block the blood vessels. And when that happens, patients suffer a lot of pain related to these deformed cells blocking the blood vessels.
And we have an illustration up now, so demonstrating these sickled cells kind of clotting up and binding inside a small vessel. How are sickle cell crises treated? Does it go beyond pain management?
Absolutely, because sickle cell crisis affects the organs, causes organ damage. So when a patient presents to us with sickle cell crisis, we do give them pain medications because their pain is intense, like having a broken bone. You know, so when a patient tells you, I'm in pain, we listen. So we give them IV pain medications, we give them IV fluids, and then we find what's triggering this sickle cell crisis. It could be an infection, so they may require IV antibiotics. Sometimes this crisis can cause something called acute chest syndrome, where they may have difficulty breathing, so we have to address that. These sickle cells are also very brittle and they break apart, so patients present with anemia. They're feeling weak, dizzy, they may require blood transfusions. So when a sickle cell crisis patient comes to us, we look at the whole picture, we treat them holistically.
So these kinds of crises are usually have some inciting event, or they also happen randomly as well?
They can happen randomly because it's the nature of this sickle cells to sickle and block the small vessels and cause the blockage. It can happen randomly. A person could be waking up to go to school, boom, pain crisis. They could be at their job, they have to stop and be rushed to the hospital. So it can really affect the quality of our patients' lives. Yeah.
So some patients describe the pain as stabbing or sharp and sometimes throbbing, and as Dr. Shunay just said, it feels like a broken bone. Linda, how do you describe the pain you feel?
Just like Ms. Dr. Shunay had stated, the pain is, it varies. It could be anywhere, and when there's a blockage, it could be on the joints, you know, any joint from the elbow, the wrist, the knees, the ankles. And then, as mentioned, the acute sickle cell, the acute chest pain. And sometimes they have to go all the way to, like she mentioned, discover what may have triggered the sickle cell. Because most often than not, sometimes it's something else that is triggering that sickle cell. And unfortunately, most things that we have, they always show up as if it is a sickle cell crisis at first. And then you have to start treating the pain. But when they've treated the pain so many times and the pain is not going away, then it means that there's an underlying problem. And recently for me, I had acute chest pain. I couldn't even sit down. I could only sit in a tripod position. And I thought, wow, this acute chest pain is more serious than I've experienced in a while. Turned out it was pneumonia that was the underlying factor. But they had to get my pain down first in order for them to discover, you know, to be able to get me to get a CAT scan and the rest of it for them to discover that it was pneumonia and then treat the pneumonia. So again, the pain varies. Sometimes it's throbbing, stabbing pain. It's stabbing enough to the point where if it's on the legs or the ankles, I will not be able to walk. And since I live alone these days, I would, hold on to anything that I can to walk up to the door after I've called an Uber so I can go to the emergency room or get my infusion pain therapy as needed. But yeah, it really varies, but mostly pain, ankles, most of the joints, throbbing pain. And it lingers. It could be anywhere from, a day, 2 days, 3 days, and usually by the time a patient is coming, by the time I'm going into the emergency room, I've been trying to manage my pain for like a day or two or longer. And sometimes you're lucky you can manage the pain at home, but other times if it's persistent, then you have to go in, you have to go in.
Yeah, oh my gosh. So something simple as a common cold could set this off. So
yes.
It's not, it's just normal things.
Yes, because absolutely, we also have a compromised immune system. So as a result, if you're around someone that has a flu-like symptom, it might trigger, if you contact that, you get flu, and then it triggers the sickle cell as well. So you have to watch out for those things as well.
So how often are you pain-free?
Recently, it has been 2-3 days a week pain-free. And usually, like Dr. Shune mentioned, I will wake up in the morning and go, how do I feel? It's always, as soon as I wake up, how do I feel? I have to do that check. Okay, I feel great. How much can I accomplish while I feel great? Because you don't know when the next pain crisis is going to happen. And these days, the older I get, the more I now that I've started journaling everything that triggers my sickle cell, I know being too happy triggers it. And I have a problem there because I'm always too excited, so I have to be like, calm down, Linda, calm down, Linda. I have to talk to myself because I know it's going to trigger something later. Also, if I am stressed or panicked and I hyperventilate, it triggers the sickle cell. What else? If I am in a cold environment, it triggers sickle cell. So for example, I'm here, I have layers underneath just to make sure I, don't get cold too much. What else? If I fly, it triggers the sickle cell because oxygen, or the higher you get, the less oxygen you have. So that also triggers sickle cell for me. So I have not traveled to see my parents in 15 years because I'm nervous about having a sickle cell crisis when I land back home in Nigeria. So I just make the best of every day. I take it as best as I can, and now that I'm more open about my health, once upon a time I used to be shy about talking about my condition. However, now I'm no longer that way, Having to be on this program, this gene therapy has really led me to become more open and ask for help and talk about it more. So now that I've started doing that, I've started discovering, other things that could help me. So for example, if I travel, I would have to travel with like a portable oxygen tank that could help me reduce my sickling. If I have a program or something to do, I always prefix by saying, if I feel good, I will be there, I just have to be honest about my circumstances, whereas before I wasn't, and I felt like I was letting a lot of people down when you miss family events and things like that. However, that's no longer the case. So I'm always honest, and I let people know, hey, I woke up not feeling good today, so I might not be able to make that event. However, can we do something else later? That used to be debilitating, when you miss out on a lot of family events and miss out on family, just your family growing, you can't be there with them because you can get infected, not because they want to infect you, but because you have a compromised situation. But being open about my situation and communicative about it to the people around me has definitely helped me be in a better place.
Well, we're certainly happy that you're brave and honest and you're helping educate our audience. Thank you so much for being here.
Thank you.
Really important. Yeah. Linda, you shared a video clip from one of your recent hospital stays. Let's take a look.
Of course, I'm a tad nervous about being discharged, but I am so looking forward to it. Anyway, this is my view, but this is the first day since I've been here that I've had such a pretty view while I was able to get out of bed. So I am giving it a record. Remember, no matter how tough life is, always look for the little things, the little fun things, the little things that could lift your spirit, make your spirit soar.
Wow, that's make your spirit soar. That's a great message. But can you help us understand how often are you in the hospital or seeing a physician?
Recently, I have been in the hospital almost every other week. But I'm receiving gene therapy treatment as we speak. So as a result, I have to be in the hospital almost 3 times a week, either for dressings or blood cell exchange and or apheresis, and sometimes consultation with my team, just so I can know what my next steps are. But prior to that, it was terrible. I would go into the emergency room 3 to 4 times in 1 month.
Okay. So you also shared a clip from one of your blood transfusions,
Yes.
out with the old and in with the new.
Yes.
Dr. Shanae, how do these transfusions help the patient?
Absolutely. So this is called exchange transfusion, whereby we bring in donor red blood cells and take away our patient's red blood cells. What this does, it decreases the percentage of sickle cells in the blood below 30%, and that will decrease the incidence of sickling. So we're shooting for less than 30% sickle cells by infusing fresh blood from donors and taking out the old blood.
Okay.
Yeah.
And we'll get into gene therapy later, but how often does that exchange have to happen to prevent these types of episodes?
So you will have, go ahead, Linda.
Yes, I'll be happy to take this one. So far, I've had 3 red blood cell exchanges, and every time I have a red blood cell exchange, I'm like, can I just stay and keep having one every day? Because one big thing with sickle cell is fatigue. I'm always tired, always. So when I have, right after my red blood cell exchange, I feel like I'm superwoman. I can do anything, I can fly. So I'm like, can I just stay here and have this every day, please? Yeah, that's really how I feel after one.
Yeah, excellent, yeah.
And Linda, we brought a camera into one of your recent appointments, and we noticed that they're taking blood from your port. Why do you have a port?
Good question. Thank you for your question. Well, one of the disadvantages of sickling, when you're sickling, your veins disappear or they become non-existent. So when I have a hard time for them finding my veins, and that always would give me a panic attack prior to coming into the hospital. So thankfully, my team, my gene therapy team, and Ms. Sarah suggested putting in a port, which I was super nervous about because I thought it was going to be a very extensive process. And they got it put in, and since then, that's been the best thing that happened to me. So I'm like, oh, take all the blood you want. So that's how they do my red blood cell exchange. They can give me infusions through there, my pain medications through there, everything through there. No more poking or prodding. So I'm just like, I'm yours, do whatever. As long as it will make me feel better, I'm there for it.
Yeah. So this is one of those diseases where you can actually look healthy from the outside. Do you ever meet people who don't understand or don't even believe you when you say you're in pain?
Absolutely. Absolutely. I have that at my job. So when I say I'm having a sickle cell crisis, I have people are like, oh, I'm so sorry. And then they still expect, there's still the expectation because you look normal. But it's only people that now are in the know, like they can look in my eyes and tell that I have jaundice. So my eyes are a little yellow. They can tell I'm fatigued or I'm walking slower or my energy is not at its usual hyper level. And then they ask, are you okay? But prior to that, because you always look fine, you look like nothing is wrong. It's an internal thing. It's tough to get that message out to people. And as a result, one of the difficult things is going into an emergency room and saying, I'm having a sickle cell crisis. I need help. Unfortunately, before I found this team, I would go into an emergency room and say, I'm having a sickle cell crisis. And they would ask me, what is sickle cell? And so I'll be like, okay, I'm hopping out of the hospital now because, but that was in a different state and in a different lifetime. However, I am so happy that I found this team because as soon as I come in and I say I'm having a sickle cell crisis, they don't even ask what's the pain level, how long have you been managing the pain, because they already understand this, they've been dealing with this, they just treat the pain and then they take things from there.
Yeah. Sarah, what do you hear from Linda and other patients with sickle cell disease? How does it impact their quality of life?
Linda, you've talked about a lot of really good points with quality of life. The symptoms, fatigue, pain, you just touched on this, the stigma of pain and pain management. So I think that makes life hard because you're going through the pain acutely, but also emotionally because you have to deal with the way people treat you and the way people think about you. So I think that it can be really hard.
Yeah, you're absolutely right. Pain it's a funny beast. Everybody reacts to it differently, and I have the feeling you're a pretty tough person, so I'm pretty sure that people don't realize how much pain you're dealing with.
Right, no.
So there are new gene therapies, but sickle cell disease can already be cured with a bone marrow or stem cell transplant. Sarah, can you give us an idea of just how challenging the BMT process is and why gene therapies may be easier on the patient?
Yeah, easier is probably subjective. There are some people where a stem cell transplant or a bone marrow transplant, same thing. There are some people where that would be the appropriate therapy for them, but if gene therapy is the appropriate therapy for you, some of the differences are the amount of time it takes. If you get a donor transplant, you really have to commit at least 3 months to the process. Gene therapy, 30 days, could be more or less, but the time commitment is a little bit shorter. Graft versus host, also called GVHD, is something that can happen with a donor transplant. You don't have to deal with that with gene therapy because it's your own stem cells. So those are probably the two big differences, time commitment and some of the side effect differences.
I think another important point is finding the donor.
That's right, yes.
Right. So sickle cell affects mostly African American patients. There's only 20% chance of finding a donor, either a sibling donor or a match unrelated donor. So if you don't have a donor, you can forget about the transplant. Here recently, we're able to use a half-match donor to do a transplant, so we're getting better. And you're right, for some people, transplant is the way to go because gene therapy is only approved for people ages 12 and above. So if you're 12 and below and very ill with sickle cell, you may need a transplant. And some people, who have organ damage, they may do better with a transplant, So we assess people who come to us for sickle cell therapy, and we offer them both. They're available. If you have a donor, it's available. But ultimately, we are very happy to have gene therapy in our hands. Yeah.
So you tailor the treatment to the patient in front of you. So,
Absolutely.
So these new gene therapies have to be really exciting for you in your field. There are 2 of them approved last year by the FDA, Casgevy, and you got to help me if I'm messing this up, Casgevy and Lyfgenia.
Right.
What are they and how do they work, starting with Casgevy?
Okay. So we spoke about the red blood cells and the hemoglobin. When we are babies inside our mother's womb, our hemoglobin is fetal hemoglobin, okay? So what Casgevy does, it tries to turn back the clock. They use gene editing to make small cuts on the DNA to release the production of a fetal hemoglobin. And the fetal hemoglobin does not sickle. It's a miracle. So that's how Casgevy works, okay? Lyfgenia, what it does, we insert a DNA code that produces a new hemoglobin that does not sickle. So in both cases, we have our patients without sickling. And this works for upwards of 90% of the people freed from sickle cell crisis, or the number of sickle cell crises drastically reduced. Linda mentioned going to the emergency department 3 times a month. Oh my God, that's a lot. With gene therapy, you could be freed from that level of care and be left to just resume your life.
Yeah, I try to stay out of the ER all the time myself, professionally and personally. I understand. We keep on saying gene therapy. This is precision medicine. Is this cellular therapies? Both terms apply to that?
It is. So here's the deal. A patient who is considered for gene therapy, we collect their stem cells from their blood. We use their veins to collect their stem cells. These stem cells are sent to a laboratory to undergo editing, either Casgevy or Lyfgenia. Now we have the cells back in our facility. What we do next is cell therapy, because we have to find a way to get these cells into the patient's bone marrow so they can become their new stem cells. How do we go about that? And this can sometimes surprise patients. We have to use chemotherapy to create space in their bone marrow. So when we infuse these edited cells, they can find a place to grow in. So that's the cellular therapy aspect of gene therapy. Gene therapy is happening in the lab. Cellular therapy is what we do to get the cells into the patient.
Okay, that's a great explanation. Sarah, what is this process like for a patient?
Yeah, so a patient comes to us to find out about gene therapy. Then we start the evaluation process. That's a lot of testing. So, MRIs, CT scans, lung function test, heart function test. We want to make sure that the patient is fit enough to get the chemotherapy needed for gene therapy. So a lot of tests, any sort of referrals we need to make. And once we've determined we can proceed, then it is a longer process because we have to have a washout period of any medications you take for gene therapy, for sickle cell. So during that washout, that's when the red blood cell exchanges are important. So that can take a couple of months, and then we collect the stem cells, and then the stem cells are processed, which can take some time. And once we have the correct dose, then we do the infusion after chemotherapy.
It's a much longer process than most people expect. It could be up to a year.
Yeah.
But Linda is going through this process meticulously, courageously, step by step.
So Linda, maybe you can tell us a little bit. You've started the process for Lyfgenia. What have you done so far, and what's next?
The part that is coming up so far is the most exciting part and the most scary part. But exciting because I'm now finally going to get the mobilization, which is when they're going to get me ready to harvest my stem cells. And then the next day afterwards, they'll be harvesting my stem cells. And I have to stay in the hospital to get monitored during that time. And then there's the hurry up and wait for the stem cells to get edited with Lyfgenia, and then hurry up and come back so that there will be that chemotherapy and infusion, and that's the part I'm looking forward to the most. To get started, my first consultation, I believe, was June of last year or something. That was my first consultation, and don't hate me, I was so happy that I walked into the hospital and I saw someone that looked like me. That is rare for me. So Dr. Shune, when I saw her, I was like, okay, maybe she understands sickle cell. And she did, and that was super helpful, and she was welcoming about it, and I was willing to explore the process because I was super nervous about the side effects. You hear crazy things out there about side effects, but it was better to have that consultation with both of them, and they pretty much explained these are the side effects. And no matter how serious those side effects sound, they're nothing compared to what my lifestyle that I've been living.
Well, I'm glad you brought that up, that seeing someone that looks like you and understands the process is very important, and I think it leads into the next thing, is that it's important to have a community, and you found some friends in the sickle cell community. What do you talk about with them, and how do these people feel about the new gene therapies?
So I'm super excited that I found this group. Totally found them when I decided to be open about my sickle cell disease. And I found this group, and they're so helpful and so amazing in that they support each other. This group was founded by the Mr. Eric Uriel's mom, and he unfortunately passed away like 3.5 weeks ago. But he has been a major, he and his mom has been a major influence on this sickle cell group. And usually what we talk about is, what are you looking forward to as far as your gene therapy cure goes? What have you done? What did you do to qualify for it? Now there's one person in my sickle cell, in my warrior group, and she's about to start the process too. She lives in California, so it's a little bit longer process for her over in the state of California. But that was something she was very nervous about starting before. But when I started, now we talk constantly about what I'm doing, what my next steps are, and what my obstacles are, so that you know, she has a better experience of what she can ask her providers when she goes in. So that the ability to be able to inspire someone else, you know, that is going through the condition, you know, is, for me, that's the most inspiring thing. Because, you know, knowing the amount of pain that I go through, having someone else go through that, it just the thought of it hurts. So if I can have and share that with one person, I'm super happy. So yes, I'm sharing about gene therapy and the prospects of having a full-time cure down the road. That's what we talk about the most now.
I'll bet, absolutely. Dr. Shunay, like all things in medicine, it sometimes comes down to talking about cost. Because these therapies run somewhere between $2 and $3 million, who pays for that and how?
That's a very good question. You know, so in Linda's case, she continues to work despite all the struggles. So she has an employer-sponsored insurance which is paying for this. For our other patients who are not able to work and who are on Medicaid or Medicare, we are negotiating to see how we can get reimbursed. I think our nation has put a bit of emphasis on getting this done. The National Institute of Health, our political and our representatives are working to make this a reality for as many people as possible. So there's a vested interest, because even if you spend $2 to $3 million one time, it will save a lot of costs down the road. Mm-hmm. Not only that, you will regain a working member of society, really change lives and communities. So it's absolutely worth it.
Yeah, I think that's a fantastic message. I think that we lose track of things because we think of what's in front of us right now. Right. And my field is transplantation. So when someone gets a kidney transplant, well, they're off dialysis. The savings balances out in 2 years. This is exactly what you're talking about. So great answer. Thank you. So we're here to answer your questions. Please send them in using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. So the weather's getting nice out there and hot. We're seeing lots of people out and about, and that means we need to talk ticks and preventing tick-borne illnesses. What illnesses are we talking about?
Yeah, so again, talking about tick-borne illness as opposed to measles, which is extremely easy to catch and really one way to protect yourself, and that's through vaccination. Tick-borne or vector-borne diseases like ticks and mosquitoes, which can spread diseases, there are multiple ways to protect yourself. Now, what diseases are we talking about? Again, for mosquitoes around here, it's really mostly going to be West Nile virus. We know that the past couple years, Kansas has had higher increases of the disease. Last summer was a little bit less than the previous 2 years, but we always need to be vigilant and watching for that. For ticks, around this area, Kansas and Missouri, we really do have a lot of the bacterial diseases, ehrlichiosis and Rocky-Mounted spotted fever. We do not have a lot of Lyme disease, despite what people think, based on the best data that we have. We do have the ticks that spread Lyme disease, but those other pathogens, ehrlichiosis, Ehrlichia, and Rocky-Mounted spotted fever are much more common, and we see those every year. There are other viruses that the ticks can spread as well. Bourbon virus and Heartland virus are two of the main ones as well. So there are a plethora of diseases that can be spread by both these mosquitoes and ticks, which a lot of people have a lot of run-ins with every day.
So what are the best practices for preventing tick bites?
Yeah, and like I said, there are multiple ways, multiple layers which you can do to protect yourself. There are no vaccines for any of the diseases, so just understand what are you doing. So are you going to be outdoors? If you are, where are you going to be? Understand that really ticks and of course mosquitoes can be anywhere. So understand where you're going to be, wear the proper clothing and gear. Try to avoid contact with the ticks, so these long sleeves and long pants will help with that. And again, most importantly is using insect repellent that is EPA approved, especially with the DEET component, will help reduce your chance of getting bit or having those ticks embed into your body and take those meals.
So we know we have many questions. Let's head to Studio B with the Honorary Dr. Alexis Del Cid.
Doctor of Fun. I'm not an MD. Amy has a great question. Amy wants to know, is sickle cell disease the same as sickle cell anemia?
So sickle cell disease can lead to sickle cell anemia, which is low blood counts, but sickle cell disease can also cause vessels to be blocked, and it can cause severe pain crisis. It can cause organ damage. It can cause stroke. So sickle cell disease is the problem. One manifestation is sickle cell anemia.
Yes. Yes. We have some great comments coming in and messages for Linda, so I want to share some of those. Linda, you have a lot of admirers. Nate writes, Linda is such a great person and is every bit of a warrior. She pushes through the pain. She shows up as much as possible. Her spirit shines through, and she helps uplift me on my darkest days. That's so sweet. That's from Mimi J. Mimi J.
Thank you.
Do you have your tissues ready? I have more.
Yes. I've been using them.
Marcia writes, thank you so much for your courage in sharing your story today, Linda. Do we know how many people are living with sickle cell disease in our areas? Are many able to take advantage of the gene therapy? Are there support groups that Linda participates in, or are they available for others?
So in the United States of America, we have about 100,000 patients living with sickle cell. Worldwide, 8 million. So it's more common than people think. To the other question, I'm going to ask Linda, tell me about your support group and your community. Yeah.
I've been fortunate to meet the sickle cell warriors. They're the Midwest Uriel Foundation. So they've been super helpful. They're one of my biggest supporters. So I have so many of them, and it's so easy to interact with them because, again, they're walking in my shoes, you know? So they experience the same challenges that I experience, and that is awesome, not having to explain my pain, my struggles with them because they're coming from the same place. So I love that. And they try to do things that encourage us to come outdoors, such as, you know, last year we did the fun walk, where we encourage people to walk. So I walked 1 mile and I was so proud of it because usually I'm tired all the time. And they organized that for the warrior community, and that was awesome. We had such a great turnout. The other group I recently found was my church community. It's the Downtown Church of Christ in Kansas City, Kansas, and they have been such a supportive group as far as, you know, if I'm sick and in the hospital. I have no family. You know, my immediate family is back in Nigeria. However, God blessed me enough to be able to find sisters that are so supporting in the sickle cell community as well as in this church. And I've been so blessed with them because every day they call and check on me. When I'm in the hospital, they call on me, they check on me, and they sing to me because that's my love language. So I have people singing to me when I'm ill and in the hospital. So it doesn't matter how much pain I'm in. If I can put a smile on my face, with that one song, it has uplifted my spirit for that day. Wonderful. So I'm really lucky to have found this group, these groups.
I think I'm reading messages from your Kansas City family here. You made your own family here. Victoria Harris writes, I am so proud of you, Linda. I am always here to pray for you and support your efforts throughout this process. And then Mimi chimed in, courageous is 100% correct. We are super proud of Linda. We have another viewer that says, thank you, KU, for this discussion. Sickle cell disease is underfunded, overlooked, and wholly misunderstood. It is incredibly important that our warriors speak up and speak out knowledgeably about our lives with sickle cell disease. Marie writes, the comfort Linda felt seeing Dr. Shune is so special. We are so lucky to have Dr. Shune at the health system. Yes. That must feel good, Dr. Shune, to hear that from Linda.
I'm very fortunate to be Linda's doctor. I am. And I look forward to taking care of many more sickle cell patients in our community. I want them to come back to us. We have a cure.
Gene Reardon has a question for Dr. Hawkinson. Gene has a question about COVID. He wants to know, how long after you have COVID should you get another vaccination? Do you have to wait 6 months?
Mm-hmm. You know, the recommendation we've been giving, especially if it is in that time where new vaccine updates are recommended to get. I don't know what your spacing is, if you've received 2 already within the calendar year. Again, for the updated, they did recommend that everybody should get one, everybody a year and older, 6 months and older. And then there are certain populations, especially age-related populations, that can get a second dose 6 months later. If you've already had the disease or if you've had it recently, in general, we have always recommended waiting about 90 days or 3 months before getting a new updated vaccine. And that's because you've now had the disease, you've developed that natural infection kind of boost to your immune system, if you will. That good protection will last you for those 90 days. So it's not until after that that you should get the vaccine. And remember, there will probably be new updated recommendations for the COVID vaccines coming out later on this year. So we'll wait to see what those are. But to answer your question, typically what we have recommended is that waiting about 90 days after your COVID infection before getting another vaccine dose is probably the best.
Thanks, Dr. Hawkinson.
Yeah.
This has been a great discussion. I'm grateful to our guests for being here. I'd like to get some final thoughts before we go. Sarah?
Oh, I didn't want you to start with me. You know, I'm just, so happy for Linda. And then I hope that we see more patients.
Amen. Amen.
Linda?
I am super excited for the gene therapy and super excited to be inspiring others to discover that there's a cure, whereas 15, 20 years ago, there was no such thing as hope for a cure. So yeah, super excited to just be sharing this news and can't wait for more people to have this type of therapy so that life is possible with sickle cell.
Thank you.
Absolutely.
Dr. Shune?
Yeah, I echo Linda and Sarah. We have something in our hands. Let's give it to those who need it as soon as we can so they can move on with their lives.
Amen.
Yeah. Dr. Hawkinson?
Yeah, good questions. I think this was a great topic and things that we do deal with every day. Luckily, there is good science research on there. We need to keep moving forward and looking, asking these questions and looking for these answers to help keep us all healthy and keep us having good lives and striving for that good quality of life. So we know we are involved in that here, and we'll also keep endorsing that and also keep giving you, the public, the most accurate new science and medical information.
Thank you. It's the great thing about this show is we get to get healthcare providers and a patient living the experience. And today we got to see Linda, a warrior, share her experiences here at the health system and her hope for the future, and educate the public. And you can see and tell by her energy that she's one tough lady that is very brave and going through some tough times, but not letting it slow her down. So I'm just so grateful that you joined us today.
Yay!
Thanks
Sorry.
Thanks again to all of our guests, even the bubbles, and to our audience. See you next time.
I'm Alexis Del Cid on the next All Things Heart. One cares for patients with mechanical hearts, one guides patients involved in clinical trials, and this one has grown her career into managing an entire program. What all these nurses have in common, Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.